Dear students, today we will discuss on diseases of cucurbits and its management. Cucurbits belong to the family Cucurbitaceae, includes about 118 genera and 825 species. In India, a number of major and minor cucurbits are cultivated, which share about 5.6% of the total vegetable production. They are consumed in various forms, that is salad, sweet, pickles and desserts. Cucurbits are attacked by a large number of diseases. The present topic will discuss on the important diseases of cucurbits and its management practices. First one is the important fungal diseases. Downy mildew. It is caused by Pseudoperonospora cubensis. Now coming to the symptoms of the disease. Symptoms initially appear as small chlorotic lesions on older leaves and later appear on the younger leaves. In humid environments, sporangia form on the underside of leaves, giving the appearance of a whitish grey to purple fine downy growth. Severe infection results in defoliation, stunting of plants and poor fruit development. Now let's see the epidemiology of the disease. Survival of pathogen between growing season is dependent on living cucurbit host as mycelium and sporangiospods. The pathogen can infect the plants at temperature between 10 and 27 degrees centigrade with optimum day temperature of 25 to 30 degrees centigrade and night temperature of 15 to 21 degrees centigrade. Now let's see the management of the disease. Provide adequate spacing between plants to reduce canopy density. Potassium enrichment reduces incidence of downy mildew. Weekly sprays of chlorothianil or mancozeb give good control as protectants, but fail to check established infection. Next is the growing resistant varieties are the most effective ways to combat downy mildew. Next important disease is the powdery mildew. It is caused by Erysipellae cicoracearum, Sphaerotheca fuliginium. Now coming to the symptoms of the disease. All cucurbits are susceptible to powdery mildew. Symptoms appears as pale yellow spots on stems, petioles and leaves. Infection may occur on the upper and or lower leaf surface. As the spots enlarge, conidia are produced on the affected tissue and the spots take a powdery appearance. Infected leaves gradually turn yellow and may become brown and peppery. Now coming to the epidemiology. Infection can take place without free moisture on the plant surface. Although high humidity, that is 50 to 90% of RH is necessary, infection can occur between 10 to 32 degrees centigrade with an optimum temperature between 20 to 27 degrees centigrade. Now coming to the management of the disease. Grow resistant varieties when available. Weed control and good sanitation practices can also aid in controlling powdery mildew. Foliar sprays of systemic fungicides like carbendazim, dimethrimol, tridimethane are very effective. 3 sprays at 0.1% concentration at 10 days interval is suggested. Next is the anthracnose. It is caused by Colletotrichum orbiculare. Now let's see the symptoms of this anthracnose. This disease is most commonly found on cucumber, melon and watermelon. Symptoms on leaves begin as water sock spots, which typically become yellowish in appearance on cucumber and melon, or dark brown to black on watermelon. These spots eventually turn brown and may expand over the leaf surface. Stem lesions on melon can girdle the stem and cause plant wilting. Infected fruit develop circular, sunken, blackish lesions. Now coming to the epidemiology. Disease is associated with seed and infected crop debris. Spread of this fungus can occur by splashing rain, overhead irrigation, insects, field workers and equipment. Optimum temperature for disease development is 24 degrees centigrade. Now coming to the management of the disease. Crop rotation, proper drainage, destruction of cucurbitaceous weeds is useful in reducing inoculums. Seed treatment with thiram or carbendazim at the rate 2 grams per kg is recommended. Fungicidal sprays with GNF or MANF or Mancozeb or Captafol or chlorothianil at the rate of 0.2% at 7 days interval give good control. Next important disease is the Fusarium wilt. It is caused by Fusarium oxysporum, Forma specialis cucumarinum in cucumber, Fusarium oxysporum, Forma specialis melonis in cantaloupe, and Fusarium oxysporum, Forma specialis niveum in watermelon. Now let's see the symptoms of the disease. These fungi can infect host species at any stage of plant development. Wilted leaves may exhibit chlorosis and later interveinal necrosis. Initially one or more runners wilt and later the entire plant wilts. Vascular discoloration can be seen in both the roots and stems. Now let's see the epidemiology of the disease. Wilting of the lower leaves occurs at warm temperature, that is 25 to 28 degrees centigrade, and the leaves recover under cooler temperatures. The fungus survives as chlamydospores in soil and in plant debris. Next is the management of the disease. Collect and remove prune debris from the site and destroy by burning or burying. Soil solarization has been shown to be beneficial in light to moderately infested fields. Maintaining a soil pH of 6.5 and use of nitrogen source help in reducing the disease. Crop rotation out of cucurbits for a minimum of 5 years may provide control in some cases. Next important disease is the gummy stem blight. It is caused by Didymella browni. Now let's see the symptoms of the disease. The fungus can infect all cucurbit species. Young seedlings can quickly damp off following infection. In older plants, leaf symptoms appear as circular, dark tan to black spots surrounded by a yellow halo. Infected stems may develop cankers, which produce a characteristic red or brown gummy exudates. Fruit symptoms can range from small water-soaked oval or circular spots to large necrotic panels. Next is the epidemiology of the disease. The fungus overwinters on infected cucurbit crop, debris and cucurbit volunteers. This pathogen can also be seed-borne. Wounds caused by pruning, insects or field work can be important entry points for the fungus. The optimum temperature for infection is 20 to 25 degrees centigrade. Now coming to the management of the disease. Avoid overhead irrigation. Rotate out of cucurbits for a minimum of 3 years to non-susceptible host. Control weeds and remove wild cucurbits from potential field locations. Implement a preventive fungicide spray program. Use fungicide-treated seed. This is about the management of the disease. Next disease is the Phytophthora crown and root rot. It is caused by Phytophthora capsaicin, Phytophthora species. Now let's see the symptoms of the disease. Symptoms of Phytophthora crown and root rot often manifest quickly, with plant death occurring within a few days of symptom onset. Often affected plants exhibit a sudden permanent wilt. Stems can collapse while the foliage of wilted plants remains green. In advanced stages, the lateral roots slough off and eventually the entire root system may be destroyed. This is about the symptoms of the disease. Now coming to the epidemiology. Over-irrigation, heavy rainfall and poor drainage favors Phytophthora crown and root rot. Favorable conditions for this pathogen include soil temperature above 18 degrees centigrade and prolonged wet periods with air temperature between 24 to 29 degrees centigrade. Now coming to the management of the disease. Cultural practices such as drip irrigation reduce disease. Avoid crop rotation with pepper and to a lesser degree other solanum species such as eggplant, tomato. Fungicidal sprays and soil drenching have also been shown to be effective. Next important disease is the angular leaf spot. It is caused by Pseudomonas syringae, Pathova lacrimans. Now coming to the symptoms of the disease. Foliar symptoms initially appear as small water-soaked areas on the underside of the leaf, which develop an angular appearance due to restriction by the small leaf veins. Leaf spots turn brown and may develop yellow halos. Infection on stems, petioles and fruit first appears as water-soaked spots, which may produce milky exudate under humid conditions and corresponding white crust upon drying. Next is the epidemiology. These diseases can originate with infested seed, infected transplants, or in the field from infested crop residue or infected volunteer plants. Infection occurs through stomata, hydatodes, and wounds. Humid conditions favors disease development. The bacterium can be spread from plant to plant by splashing water, insects, farm equipments, and workers. Now coming to the management of the disease. Rotate out of cucurbits for at least 2 years. Avoid overhead irrigation and entry into the field when foliage is wet. Copper-based sprays may help limit the spread of the disease. Use of resistant varieties. Next important disease is the bacterial wilt. It is caused by Arvinia trachyphylla. Vectors are striped cucumber beetle and spotted cucumber beetle. Now coming to the symptoms of the disease. This disease is severe on cucumber and melons, but is less damaging to squash and watermelon. Symptoms begins with wilting, which may be confined to individual runners or may involve the entire plant. Plants may wilt at any growth stage, but wilting is often most severe during periods of rapid growth. Now coming to the epidemiology of the disease. The bacterium is transmitted by cucumber beetles. The bacterium is short-lived in dried plant debris and does not typically survive in crop debris from one season to the next. Weeds and volunteer cucurbits serve as alternate host and facilitate survival between crops. Now coming to the management of the disease. Control cucumber beetles. Eliminate all weeds and volunteer cucurbits. Remove and destroy infected plants as soon as they are identified. Rotate out of cucurbits for 2 to 3 years. Now next important disease is the cucumber mosaic. It is caused by cucumber mosaic virus. Regarding the vector, there are several aphid species responsible to transmit the disease. Next is the symptoms. All cucurbits are susceptible to CMV, that is cucumber mosaic virus, but watermelon is rarely affected. In cucumber, leaves becomes mottled and distorted with downward curling edges. All subsequent growth is reduced, leaving the plants dwarfed. Fruit are often misshaped, mottled, warty, and reduced in size. Infected fruit may appear bleaches due to lack of chlorophyll production. Next is on melon. In melon plants may exhibit severely stunted growing tips, even if fruit does not express distinct symptoms. Overall fruit quality is often poor. In pumpkin, early infection often results in severe foliar mosaic. Fruit may be rendered unmarketable due to mosaic symptoms. In squash, early season infection can result in severe stunted plants with deformed leaves. Petioles often exhibit a downward or bending growth pattern. In watermelon, foliar symptoms are often mild when compared to other cucurbit hosts. Mild leaf crinkling with some yellowing may be observed. Now coming to the epidemiology. CMV has an extensive host range above 1200 species, facilitating its survival on weeds, ornamentals and other cultivated crops. The primary mode of transmission is by aphids in a non-persistent manner, although the virus can also be mechanically transmitted through equipments and workers. Cucumber beetles have also been shown to transmit CMV, but aphids are the primary vector. Next is the management of the disease. Management of CMV through vector control have been only marginally successful. Avoid planting near older cucurbits and perennial ornamental crops. Control weeds, use reflective mulches, deep plow crop residues. Implement a comprehensive sanitation program for workers and equipment to minimize disease spread. Commercial varieties with resistance offer the best means to control CMV. Now coming to the nematode diseases. First one is the root knot nematode, then sting nematode, root lesion, reniform nematode, stubby root nematode and pin nematode. So these are the nematodes which are affecting the crop. Now coming to the conclusions of this topic. Cucurbits are affected by a number of diseases like downy mildew, powdery mildew, gummosis, Phytophthora blight, anthracnose, fuma blight, collar rot, fusarium wilt, white rot, root knot nematode, bacterial wilt, watermelon bud necrosis and leaf distortion virus. These diseases are of national importance and cause important economic losses in cucurbits. Timely diagnosis, then applying different remedial measures can minimize from the loss due to diseases.